Good morning, everyone. It's time for another Chuck Chat. It's the first Chuck Chat of the new year. Happy New Year, everybody. Let me put my screen on here. Hopefully. Here we go. So, not a lot today to start off with is humor, but my goals for 2021 is to survive and to forget 2020. So, good advice for everybody. Westminster COVID-19 numbers since the beginning of actually March the 9th of 2020 is when this all began. 24 residents cases. We've had 3 deaths at our community. 18, I'm sorry, that number should be 21 cases that have recovered. We've had 34 associates that have come down with COVID-19. Most have recovered. 2 are currently recovering with light symptoms. Total tested, including resident staff and private caregivers, 3,757. Our infection rate's 1.76%, so less than 2%, which is really extraordinary. I'm hearing colleagues of mine with infection rates around 30%. Kansas counties that are presenting with 35% infection rate. So as bad as it is in Travis County, it's a lot worse than other places. This is a COVID tracker that I usually try to show everybody. You can see the graphs changed quite a bit because of all of these reported cases that were caught up, I guess, on this date. So we're still well above 5,000 cases per day in the state. Which is kind of the plateau that they're hoping to reduce down to. Our Texas is being beat by California currently. Texas was in the lead, but California's had a huge COVID spike, especially in Los Angeles County. So they're currently, I guess, losing that battle. Independent living visitation remains the same. Scheduled visits with reception. Visits may take place in designated locations only. Visits are limited to 2 persons for 1 hour. Social distancing and masks must be worn. No eating or drinking with visitors. Associates will address residents and visitors that are not following the protocols, and visiting hours continue to be restricted to 8 a.m. to 4 p.m. This is for independent living. Phase 2, we are still in the middle of phase 2. Really the only change has been the 25% reduction in capacity for the Laurel dining room. That remains in effect. Travis County is in stage 5, so I think our current precautions are working and we will continue to work. And we need everybody's cooperation and making sure that we're following all the precautions and restrictions so that we can enjoy this phase of reopening. We have implemented a grab-and-go continental breakfast that has begun, as well as a breakfast menu in the Laurel now that was requested by the residents that they'd like to have hot breakfast available. That is available 7 a.m. to 9:30. The continental breakfast is available in 2 locations, and we'll talk about that in a minute. Health center visitation guidelines remain the same. They are restricted to essential caregivers only. They have not had any new resident cases in the last week, and hopefully it stays that way, but they have had a new associate case. So the restrictions stay in place with regard to visitation. Please do wear your mask like London does, which is the top picture here. It's very important that you wear your mask properly, even after the vaccine. Questions and answers. Well, I've had quite a few questions about the vaccine, so I'm going to try to answer those in the next few slides. The only other question I had was about the pool and when will it be open and why isn't it open and why is it taking so long? The pool is open and ready to use today. Hopefully the spa will be open later this week. Very sorry for the delay and the inconvenience. So vaccine information, as most everybody knows, we have partnered with CVS Omnicare for many years. They're our pharmacy partner. and coordinate approximately, they will schedule and coordinate approximately 3 on-site clinics directly with us, which they have done. The first clinic was for healthcare and assisted living. The next clinics are on the 7th and 8th, and these will be for all of our associates and residents in independent living. Vaccines are being ordered by them, PPE, all the syringes, the needles, everything, they're taking care of that. They're also ensuring that the cold chain management for the vaccine is being accomplished. They're providing the administration of the vaccine on site. They report all the required vaccination data and adhere to all applicable CMS requirements for the testing. Vaccine clinic schedule, this hasn't changed. It's still, clinic 1, which is what we're in the process of going through right now, is happening. It is dose 1 of the vaccine. It's a 2-dose vaccine. You get 1 dose and then you get a booster dose in 21 to 28 days based on which vaccine you're taking. And then they'll do second clinic and a third clinic for those who need the second dose, and then those that may change their mind or come in new admissions or new staff. So those folks that missed that opportunity will have another opportunity. We don't have dates for that yet. We will communicate the dates when they're available. Westminster nor LCS has any control over who gets the vaccine and when. We've worked diligently, and I told others that we've worked every angle possible to get everyone vaccinated as quickly as possible. We worked with local pharmacies if we had someone that was available to work with us. Terrytown's a good example of that. We were able to vaccinate over 130 residents through Terrytown. Initially, and still today, we had no guarantees that independent living residents were going to receive a vaccine. So we began to work every angle possible to get our residents and independent living vaccinated as well. The rest of the residents and all Westminster staff that have not been vaccinated as of today will receive their first dose of vaccine on January the 7th, which is Thursday, and the 8th, which is Friday. Please watch for a document from Resident Health Services with your scheduled time for vaccine clinic to be delivered to your homes today after 1 o'clock. The department heads will be helping distribute the documents with your assigned times. We understand that the vaccines are safe, even though they were developed more quickly than others. They follow the same process. We vaccinated more than 200 individuals so far with no significant side effects. The COVID-19 vaccine clinic will be in Harris-Bell Hall. Please come to the clinic at your scheduled time. Do not come early. We don't want there stacking up of people waiting in the halls or any of that. We really want to maintain social distancing. And the Harris-Bell Hall, as large as it is, it still has limited space. So to maintain safe social distancing, we need you to come at your scheduled time, okay? Do not come early. Please wear your mask properly, sanitize, and maintain social distance at all times. Please contact the health services office, the wellness clinic, or your own physician if you have questions about the vaccine. Okay, construction update, just a little bit of pictures here. Things are going well. They continue to work. They missed a couple days for the holidays, but they're making good progress. Bridge number 2, which is the bridge that connects the Preston to the pool area and the fitness area. That work continues, should be completed at the end of this month. Electrical work inside the Windsor level 3 and 4 hallways has been completed. The tower crane has been installed. Windsor courtyard work continues as planned, as moved ahead per plan, and should be completed by May. Waterfall feature will receive stone soon. That's that wall that you're seeing out there. I've had a lot of people comment about that. It's not Chuck's wall to keep anybody in or out. It is just a water feature wall. I think it'll be really nice when it's finished. Outdoor kitchen stonework is also to begin, and then they will start pouring concrete on the Carlisle parking garage the week of the 11th. I do appreciate your continued support and patience with the construction activities. I know it's a pain, especially when the demolition is occurring. Just to give you an idea, I'll provide this spreadsheet in the summary of the chat, but just to kind of give you an idea, this is where they're talking about starting to pour the basement wall and the basement floor. So the week of the 11th is going to start concrete pouring for the Carlisle building. So that's pretty fascinating, and it gives us validation that things are moving forward. So it's coming up out of the ground at this point, which is good. They're also pouring columns over the next few days, actually next week, for the Windsor infill tower. So that'll be coming up out of the ground as well. The courtyard we talked about, they're installing light pole bases. The final grading of flat work will be completed this week. Fire pit stone facade is being installed. Yes, we will have a fire pit out there. Fountain base is being installed on the 11th. They'll start doing some stone work on that, on the facade for that around the week of the 11th. Bridge number 2, as you can see, they're making progress with that. They're actually going to be installing windows the week of January the 11th. So they're making a lot of progress there. And just to give you an idea, the bridge that I'm talking about is on the back side of the bistro kitchen. And it'll have a corridor through here, and it's going to be a veterans corridor. We're going to put some pretty neat veterans artifacts on this wall. So we are progressing. This is a shot of the rendering of the courtyard. So that wall that you're seeing is actually this water feature, the base of the water feature. And of course, there will be landscaping around it. And the fire pit that's being installed is right here. The outdoor kitchen is right here. You will notice that we have demolished the parapet wall that was next to that was surrounding the balcony on Harris Bell Hall. This trellis is going to be coming down this week in plans for expanding Harris Bell Hall and making some improvements. There's no better time than now to do that. We've added that to the project, and I hope to have a deck installed on this roof if possible. We are exploring that option now. And we are trying to push the restaurant portion of the project a few months forward. So we hope to get this project, the restaurant, finished and operating by August, September. So time frame. I'll let you know more as we know more. The just the plan, this is what the plan looks like. It's a flat plan, but it shows you lots of trees. The kind of shows you the shape of the walkway. I talked about this being flattened a little bit so that we could bring out the new wellness area. It's going to be really attractive. It's hard to see and visualize now because it looks like a big mud pit, but hang in there, it's going to get better. Selections process on the Carlisle and Windsor. We have completed 17 apartments. Selections process, we did have somebody move into Westminster sooner. They relinquished their apartment in the Windsor addition. So we have one pending that should be completed in the next couple of weeks. We've also completed 25 finalized selections on the Carlisle and should complete the rest of those through mid-January. And we still have approximately 90 priority members waiting on apartments. There's a rendering of the Carlisle when it's finished. 2021 building and grounds, just to keep you up to date, we're about at the same number of apartments completed on the interior windows project. They are currently working on the dining room, kind of the solarium area of the dining room and the Laurel. They're working on those windows. The solar film is approximately the same number that were completed prior to Christmas. That project will be moving forward. The Preston flooring replacement, I think you can tell where we are there, but we have completed the 2nd, 3rd, 4th, and 5th floors, except for the tile. We identified a new product and it's being shipped in and will be installed soon. They're also working on the 1st floor to complete that. Preston HVAC update, cooling tower has been replaced and the chiller has been tested. So it is working. Unfortunately, we don't have enough heat outside right now to really put it under a good load. So we have to wait until it warms up for that. But we tested it for 10 minutes and it ran successfully, and it was inspected by Trane, and it was given a five stars. So it looks good. Floor laundry room project is still in demolition phase, and we will be doing hot water upgrades over the next 30 days and water softening all campus. That project will be installed soon. So you will notice a difference in the hot water, especially. It'll be much softer all campus, and we should have better control over the hot water on the entire campus soon. Dining reminders is very important to turn in your weekly delivery menus no later than Saturday. The Continental Breakfast is now available as grab and go in 2 locations, the Laurel Dining Room and the Game Room in the Windsor. We'll also be installing some new coffee machines in those locations because the current coffee machines cannot be maintained any longer. They don't make parts for them anymore and they can't repair them. Please maintain social distancing and mask when picking up from the grab and go Continental Breakfast. If for some reason you cannot leave your apartment or you have difficulty getting around or you're ill, please contact us and we will make arrangements for your Continental Breakfast to be delivered as we do other meals. Hot breakfast is now available 7 to 9:30 Monday through Friday. As we go along, we'll be opening that up on the weekends as well. Laurel Dining Room is open from 7 a.m. to 8 p.m. The last seating is at 7 p.m. We are still at 25% capacity with social distancing. And you know, it's the menu keeps expanding and it'll get better and better as we go along. Theme meals will also be brought back beginning in January. Watch for information from Food and Beverage on that. Just some COVID-19 reminders. Always wear your mask when outside of your home or when receiving services in your home. Practice good hand hygiene. Do not touch your face, eyes, or mask. Travis County, Austin is at stage 5. There's a lot of cases out there, folks. Please stay home. Stay home except for essential trips. Limit travel and extended visits. I say an extended visit is anything more than an hour. Maintain social distance of 6 feet or more, and follow all current precautions and restrictions in place at all times, even after you receive the vaccine. Thank you all for making Westminster an extraordinary place to live and work. Stay strong. Until next time. Appreciate it.